Okay, we're going to do subtalar and forefoot inversion and eversion grades 1 to 4. So again, setup is important. So Neil, could you just move over slightly towards me of your lower half? Perfect. Okay, we need to make sure the bed height is correct. For in an eversion of the subtalar joint, the knee is going to be bent and they're going to be laying prone. So I need to be in a comfortable position. And here I feel a little bit like my shoulders have got to come up. So I'm going to lower this bed a little bit. That's better. Slightly more. Never worry either about making sure that you get the bed comfortable in a position for you so you're not raising your shoulders up. Okay, so for inversion and eversion of the subtalar joint, we need to try to remove any forefoot influence by taking the foot into dorsiflexion. We're going to control that with our forearm in this instance, of my left arm. Okay, and then we're going to come over the top, and you need to feel for, on the medial side, the talus, because it's subtalar. On the lateral side, the distal fibula covers all of the talus, so we don't need to worry too much about that because we are therefore on the calcaneum. Okay, so we've got the calcaneus, medial and lateral. If we start off with inversion coming towards the camera, now simply roll the foot in. It needs to be a pure movement, don't allow any twist or rotation. So pure movement coming into inversion here. Testing the range, obviously feeling for resistance, asking for pain. I'm going to do my grade 1. Okay, you can probably see slightly more of my wrist movement than you can actually of foot movement. Nice and small. Grade 2, much larger range, again staying out of resistance into inversion. Grade 3, just adjusting my grip to make sure I've got a nice firm hold. Taking it into resistance, using my forearm here to keep this in dorsiflexion. Inversion here, so grade 3, larger amplitude into resistance. Grade 4 for my end of range. When you get to the end of range as well, try not to just push away. Actually, as you push, also try and almost slightly pull the leg towards you. It'll just help use the rest of your body for some of your forces to apply that end of range overpressure. So we come here, and as you can see, I'm just actually pushing with my fingers, as well as, so I'm pushing here, as well as rolling my hand to pull the foot inwards towards inversion. Okay, for eversion, it's the same thing, but we're going to do the opposite again for the subtalar joint, so keep in that position here, then we're going to move the ankle towards me. As you'll notice, you don't have anywhere near as much eversion as you do inversion, so I'm going to pull that out towards me, so not a lot of range available there. So for grade 1, nice and small, again more wrist and hand movement really than actual foot movement. And then if we come into grade 2, grade 3, again now we can start to slightly push the leg away from us. Larger amplitude, and then grade 4, end of range, pushing away and pulling the foot over and rolling it towards me.